Good day. Today we will study diseases of the endocrine organs, in particular diseases of the adrenal glands. Today we will consider such a disease as hyperadrenocorticism, or Cushing's disease. The cause of the clinical signs typically seen in this syndrome is an abnormally elevated serum cortisol level. Is a common endocrine syndrome that affects middle-aged and geriatric dogs and, occasionally, cats. The disease occurs in cats of middle and older age, and female cats are affected more commonly than males. The disease can last several months or years. The following dog breeds are genetically predisposed to Cushing's disease: Yorkshire Terriers, Staffordshire Terriers, Boston Terriers, Boxers, Poodles, especially miniature poodles, Dachshunds. Pituitary gland tumor, the most common cause of Cushing's disease and accounts for 80 to 90% of all cases. Adrenal gland tumor accounts for 15 to 20%. Excessive cortisol levels can occur as a result of long-term steroid use. Naturally occurring hyperadrenocorticism is uncommon in cats, and the iatrogenic form of the disease is also relatively uncommon as cats are quite tolerant of high doses of corticosteroids. Normally, the amount of cortisol in the blood is controlled by interaction between the adrenal glands, the pituitary gland, and the hypothalamus. When cortisol is needed, e.g., to respond to a stressful situation, the hypothalamus signals the pituitary gland to release adrenocorticotropic hormone, ACTH, which prompts the adrenal glands to produce cortisol. In turn, high levels of cortisol in the blood cause the hypothalamus to decrease its signal to the pituitary gland, which in turn produces less ACTH, thereby reducing the demand for cortisol. This relationship is known as a negative feedback loop. Pathophysiology. Excessive glucocorticoids cause increased gluconeogenesis and increased glycogen stores in liver. From the pancreas, peripheral resistance to insulin occurs, and insulin production is initially increased. Later, depletion and death of beta cells occurs, and diabetes develops. Or due to glucose toxicity, there is a decrease in insulin secretion and diabetes develops. Loss of muscle tissue and weakness occurs due to increased catabolism of protein. Glucocorticoids have a direct catabolic effect on the bone matrix, increasing the excretion of calcium in the urine and suppressing vitamin D. A negative calcium balance with an excess of glucocorticoids increases parathyroid hormone, which leads to osteoporosis. Hyperkeratosis occurs, collagen is lost, atrophy of hair follicles occurs, protein metabolism is disturbed. The skin becomes thin, wounds heal poorly and scars form, hair growth stops. Leukocytosis occurs, the number of lymphocytes and eosinophils decreases, neutrophils and monocytes increases. Effects on the release or action of antidiuretic hormone cause polyuria and polydipsia. Osmotic diuresis because of hyperglycemia. Increased calcium excretion. In the immune system, a decrease in the inflammatory reaction and a decrease in the immune response are observed. Increased lipolysis. Fat deposits are redistributed. Cortisol can have many different effects, so clinical signs can be quite variable. Initial signs may be mild, but they tend to progress over time. The most common signs are excessive drinking, polydipsia, and excessive urination, polyuria. Enlargement of the abdomen, a pot-bellied appearance. Increased appetite. Panting. Excessive panting above normal levels. Fat layer formation around the neck area. Lethargy. Muscle wasting and weakness. Poor coat condition. Periodic hair loss. Osteoporosis. Sudden blindness. Lethargy. Seborrhea or oily skin. Firm, irregular plaques on skin, called calcinosis cutis. Clinical signs in cats. Excessive drinking, polydipsia, and excessive urination, polyuria, increased appetite, enlargement of the abdomen, a pot-bellied appearance, lethargy, muscle wasting and weakness, poor coat condition, hair loss, curling of the ear tips, thin and fragile skin. In some affected cats, the skin can become so thin and fragile that it very easily bruises and can also very easily tear. Wounds may also be slow to heal. Many cats with hyperadrenocorticism also have diabetes mellitus, because the excessive cortisol interferes with the effects of insulin. This may exacerbate the increased thirst and increased urination, and the hyperadrenocorticism may also make the diabetes more difficult to control. In fact, hyperadrenocorticism should always be considered in any diabetic cat that is proving difficult to manage. Although there is no single test that will diagnose 100% of cases, can we recommend some combination of the following: baseline blood work, complete blood count chemistry, urinalysis, urine culture, to rule out urinary tract infections. ACTH stimulation test can have false negatives. Low-dose dexamethason suppression test can be affected by other illnesses. High-dose dexamethason suppression test. Urine cortisol to creatinine ratio. Abdominal ultrasound can identify changes in liver and adrenal gland enlargement or tumors. Computerized tomography scan or magnetic resonance imaging can detect pituitary tumors. Treatment. Surgery treatment. Pituitary and adrenal tumors can be surgically removed, and if benign, surgery can be curative. Medication. Treatment of HAC is never benign and should not be initiated unless the dog shows unambiguous clinical signs of the condition. Radiation treatment for pituitary-dependent Cushing's disease in dogs has been shown to improve or eliminate neurological symptoms and improve the prognosis, especially when treated early. Medication treatment. Most dogs with pituitary-dependent hyperadrenocorticism are treated medically with drugs that inhibit synthesis of adrenocortical hormones, such as trilostane or ketoconazole, or that cause partial or complete necrosis of the adrenal cortices, such as mitotane. A drug claimed to decrease ACTH secretion, such as selagelene, is not efficacious. While trilostane has become the treatment of choice for dogs with HAC, mitotane also has successfully been used to resolve the clinical and biochemical abnormalities of HAC. Both trilostane and mitotane have caused serious adverse side effects. Both drugs decrease plasma cortisol and increase ACTH secretion, which may enhance pituitary tumor growth. Trilostane has been successfully used to treat cats with HAC. These drugs interfere with the production of cortisol, but very close monitoring is necessary to ensure that adrenal function is not impaired too much too quickly. Depending on which medication is started, you have to create a plan for monitoring your dog's blood work and reaching an appropriate dose. This will vary depending on patient, length of time on medication, etc. Thank you for attention.